acoustic neuroma. Every light blue line is the real beam that's shooting through the body and intersect to the acoustic neuroma. Guess what? We have a 98% chance to control this acoustic neuroma and also help the patient to keep the hearing. The patient can still keep the hearing. This is the brain mets. This is the spinal mets. The patient is already paralyzed. The patient cannot move anymore because the tumor is pressing the cord. However, after we give a 5 treatment, patient can start walk again, and so we basically with this we treated many patients like this, and this is nasopharyngeal cancer. This is a very tough case. This is not with cyanide. This is treated with conventional radiation. With 7 weeks radiation, we can see this the squamous cell carcinoma to the brain. After 3 treatment, after 10 treatment, after 30 treatment, the 90 years old ladies cancer get cured. This is the pancreatic cancer. This is the before treatment. This is the after treatment. This is the brain mets, single brain mets, and for 40 years female, and with the 3 treatment, the tumor is gone on the right side. This is the lung tumor before the treatment, and this is 3 months later, all the tumor disappeared. This is the rectal cancer. This is the after the treatment. It's a 5 treatment. This is another brain mets, and the patient cannot walk. After the 1 week treatment, the tumor completely disappeared, and the patient started walking and go back to real life. And this is the breast cancer patient with multiple brain mets, And you can see the patient has many tumors, and we give a whole brain radiation, and we also use the cyberknife to boost. And you can see the tumor, all these 25, maybe 45 tumors completely disappeared. And the patient it's called a CR, means a completed response, and the patient get back to normal life. This is the one early stage lung cancer for the male 64 years old T1N0M0 squamous cell carcinoma. We gave a 3 treatment with cyberknife. This is 3 months later. This is 1 year later. This is 5 years later. The tumor is completely gone. There's only a little fibrosis of the lung. The patient come back to the normal life. And 5 years later, patient's alive. 10 years later, patient still alive. This is the difference. This is the latest stage lung cancer, T4N0M0. So basically, we give a 7 treatments, and 3 months later, the tumor is completely gone. The patient is doing well. This is another huge tumor. The tumor is a stage 3, 13 cm tumor with a cyberknife, and after 5 treatment, the tumor disappeared. And again, this is a small lung tumor, and after 5 treatment, tumor completely gone. This is the breast cancer patient. We treated the breast holding, and we can protect the heart really well. So conventional radiation, when we treat the breast, you can see that's what you commonly see. The patient tumor had red skin, and the skin also being damaged. And on the lower end is our breast patient. The patient's skin has a very minimum toxicity compared with the conventional radiation, because we give a very high precise radiation. And this is another case that we treated. The patient has a spinal mass, and the patient is already paralyzed. And after 5 treatment, patient come back to walk. This is another patient paralyzed, and after we treat 5 days, 2 weeks later, patient start to walk. And this is a 9 cm tumor. After treatment, tumor shrinked to 7 cm in 1 month and 4 cm in another 3 months. So basically, we have many exciting cases that we treated. Many cancer, very scary, but with a conventional with a cyber knife, you can easily control this tumor. And no matter where it is, no matter it's in the head and neck, it's in the liver, it's in the pancreatic cancer, it's the lung, no matter the large tumor or small tumor, no matter it's sarcoma, lymphoma, we can easily treat them. We have so many treatments, so many cases available that to treat. So I just want you to be aware that the cases you see today is the real case that we treated, we offer to our patient every day. And today, in our cancer center, our patient survival is as good as America and the European countries. Is better than a little bit better than China's. And that's something I want to mention, number one. Number two, in China these days, we have so many different cancer drugs than other countries, because China has many pharmaceutical companies. They have a lot of scientists to research on these drugs, and we have more drugs than most of other countries in the world, and also they are very cheap. The cost is only 10% of American's drug. So we have top doctors, top surgeons, top radiation oncologists, top medical oncologists. One thing I want to mention is when the patient comes in, we typically have 3 doctors, maybe even more, to see this patient together. And we have a medical oncologist, a radiation oncologist, and a surgeon, and also nurses. We have 4 professionals to see one patient at the same time, offering multiple disciplinary treatment to this patient. I think that's another huge advantage we have to offer the treatment for you. All right, so I think I'm sorry, it's very dry, but sometimes it's a complicated concept, and I hope you get some idea of what we can do with the CyberKnife, and I hope we can meet in person one day, either in Malaysia or in Guangdong in China. All right, I'm going to stop here, see whether you have any question for me. This is basically, I hope you can see my screen. This is using CyberKnife to treat GYN cancers, women's cancer that is recurred. That's the recurrence. So with the spinal recur. So basically, you can see on the 2 pictures. We have 80% local control for 5 years. 80% of local control for 5 years. And we have 60% survival for 5 years. 60% survival for years for GYN cancers. This is Dr. Lanciano's, my partner's. Basically, that's my partner's talk. And let me see. Back in 2000, basically in 2017. But anyway, we just have so many patients doing very well. It's just amazing. It's just amazing how patients respond to our patient. Let me see. Anyway, so I just want you guys to have some idea, because almost all the cancers you see, we have a way to treat with CyberKnife. This is the brain mets. Forget it. We have too many. Oh, by the way, I also want to mention many of you guys may have a patient recurred after conventional radiation. So this is the patient recurred. This is the American patient. They have a conventional radiation and recurred, and we will retreat with the cyberknife. Remember, many hospitals will not feel comfortable to treat with radiation again, but we are very comfortable to retreat lung cancer with lung cancer that's recurred after the conventional radiation. And this is our data. So the patient had lung cancer, got a surgery, conventional radiation, and recurred. And we still retreat. We treated again with the cyberknife. You can see basically patient's local control is 80%. Local control is 80%. And up to 2 years, 1/3, 37% of patients still survive. Is still survive. That's a good question. After cyberknife treatment, will CTC become 0? If so, how long become undetectable? I actually don't know because right now it's too we do not routinely check the CTC, circular the cell. So we don't know yet. However, I hope we can work together in the future. We can treat with the cyberknife, and you follow with the CTC and see how soon the CTC will decline. Normally, we will see the CTC decline quickly. Okay. So anyway, that's I think this is I hope what I just shared with you makes sense to you guys. And we just treated so many patients. We just treated so many patients in China. We feel very proud of ourselves, and we think we are changing. We think we are changing the world. Um, um, this is SBRT to the. Oh my God, this is SBRT to the liver. I don't think we need to go through that. It's just way too much. It's just it's a it's a lot of technology that's available in our center. We do not only have a cyberknife, we have a lean accelerator, we have a robotic surgery, we also have a CAR T. So when your patient comes to us, we will give them the best cancer care in the world. All right. So I don't know. I hope I answered you guys' question. Okay. And again, and later on, you could always we could always get in touch with each other and continue to answer your question.
Yes, thank you, Dr. Yang. Okay, so let me answer that question now. For the cost issue, right? Treatment cost in China is usually lower compared to Malaysia. But most important thing is cyberknife is not just about the machine. Doctors' experience plays a huge role in achieving the best result. And Dr. Yang's team is definitely #1 in the world in using cyberknife. So thanks again, Dr. Yang, for the very interesting and informative sharing. It's not dry at all. It's very interesting. So if there's no further question, we'll wrap up today's training. Thank you everyone for joining. But before we end, can everyone just turn on your camera and let us take a quick group photo together with Dr. Yang.
Excellent.
Open your camera.
Wow, we have so many people. So good to see everyone.
We have 31 members online together with us.
Excellent. So good to see everybody's smiling faces. Excellent.
We hope to see you offline soon. Face to face.
Yeah,
Okay,
let's
guys,
meet in person.
Yeah. Guys, open up your camera. Let's take a group picture together. All right. Good. Everyone ready? Dixon ready for the group photo screenshot? All right.
Wow, all the good-looking girls and handsome boys.
Let us put a thumbs up together. 1, 3, 2, 1. All right. Thank you, Dixon. Thanks, Dr. Yang. And thank
Thank
you
you, everyone.
everyone for joining us. Thanks
谢
everyone.
谢，谢谢
Thank
，Thank you。
主任。
谢谢大家。
OK，拜
辛苦了，
拜。
杨博。
好，谢谢。
辛苦
谢谢。
Thank you，拜大家。
Okay, Ibrahim, very
Right.
good section. Good start.
Thank you. 哇，Dr. Yang 的魅力太有魅力了，爱上好。Thanks, Dr. Yang. Not dry at all. Very informative. Guys, do you have any questions? If anyone has questions so far, feel free to type in the chat box here. Or you can just open your mic. You can just unmute. Okay, Dr. Kenny has a question.
So yeah, Dr. Kenny said if there's episcope effect, if there's episcope effect, so the dose must be high enough. That's absolutely right, Dr. Jan. So what is the episcope effect? So many times patient has more than one tumors, right? When we treat one tumor with a cyberknife with a high dose, and the cancer cell will die very quickly and release neuroantigens. The neuroantigens will stimulate the antibody, will stimulate the patient's immune system, and then the patient's immune system will kill other cancers. So basically, when patient has one tumor with multiple tumors, when we treat one, the other tumors also disappeared or shrinked. This is called episcope effect. It's an amazing effect that is the best thing ever happened. This only happened to cyberknife or radiosurgery that have a high dose every day. And conventional radiation does not have this happen. Conventional radiation does not have happen. So Dr. Kenny Yan had a really good question. I hope I answered the question. So okay, so Bernice asked which generation of cyberknife machine this is, and which generation Malaysia has. So cyberknife has 6 generations. Number 7 is the same with the number 6. So we normally call 7 the same as 6. So we have a generation 6, and we believe we checked some of Malaysia's cyberknife. We believe Malaysia has 1/3 generation. May have another 6 as well. We believe Malaysia has 1 or 2 cyberknives, and one is generation 3, the other one is number 6, but we have not seen the number 6 yet. And also, we believe we have probably the most experienced doctor in the world in our using cyberknife in our cancer center. So it's not only just the machine, it's also the doctor that we have more, with Dr. Wang, with myself, combined, we probably treated more than 30,000 patients with the cyberknife, more than anybody else in the world. if a patient had prostate cancer, did the SBRT still suggest CyberKnife? Yes. If a patient has prostate cancer, we strongly prefer SBRT than surgery. Prefer SBRT over conventional radiation. Okay, when SBRT, there's two type of machine can do SBRT for prostate. One is a high-end LINAC, the other one is a CyberKnife. And right now, the publication already show CyberKnife has less toxicity than LINAC-based SBRT. So CyberKnife is more precise, has less toxicity. Why is that important? Because the prostate patient going to live 10 years, 20 years, 25 years, right? So we need our patient have a good quality of life. We can treat, we can cure this patient. We also need to make sure the patient has a less side effect. And the CyberKnife treating the prostate has less side effect than linear accelerate. How CyberKnife can help in early stage breast cancer? That's a great question. So traditionally, right now, when the patient has early stage breast cancer, so we will do surgery first, no matter what. Then we will treat the whole breast with a linear accelerator. We treat the whole breast with a linear accelerator. However, for early stage breast, we can treat with radiation with a CyberKnife as a partial breast, which means we do not treat the whole breast. We only treat part of the breast. By doing that, we give less dose to the heart, less dose to the lung, we have less toxicity, and also even the breast, the skin has less color change. So basically, if we have a very early breast cancer, we can really treat the breast after surgery with almost zero toxicity to the heart, to the lung. Again, breast cancer patient lives a very long time. Our patients, our stage 1, stage 2 patient, 5-year survival is 100% in China, in our cancer center. So this patient is going to live another 10 years, 20 years. We do not want their heart, their lung get damaged from this treatment. And 5 years down the road. So the CyberKnife can spare a lot more than linear accelerate. So I think Dr. Kenny Young said, in Malaysia, many hospitals have many CyberKnife. Malaysia may have many CyberKnife, but we have the newest CyberKnife. But is this true? M6 the latest? And yes, there's a new model called S7. S7 is exactly the same as M6. It's just a little change on the color, so it's the same. So for 5 days, and how much the cost is Regain, and is this cheaper than Malaysia? Oh, that's a great question. So typically, I believe our CyberKnife cost is much cheaper than America. Is probably, I don't know. I think is I don't know. Maybe our staff could help. Evelyn, whether you can comment that. I believe our CyberKnife treatment is cheaper than Malaysia's CyberKnife, and also our doctors has a lot more experience. Anybody could comment on that? Okay, then another question is, what's the side effect? Will patient get has hair loss, weight loss, no appetite? No, mostly CyberKnife side effect is much lower than conventional radiation. Is also much lower than chemotherapy. Of course, it's going to be much lower than surgery. CyberKnife patient will not have hair loss, will not have weight loss. And most likely, if the patient will feel tired, fatigue, will feel fatigue. The fatigue will go away in 2 weeks because their body received radiation, so they will feel a little bit tired, but they will get recovered within 1 to 2 weeks. So it's very safe and very low side effects therapy. However, Cyberknife still has side effect. That's never say never, right? It's never zero. It still have a little side effect. When we treat a brain tumor, the patient have a little edema. When we treat a spine tumor, the cord could be damaged. That's why it's not just the machine. You also need good doctors, good people, good clinical experts to use Cyberknife to treat the patient. Renal cell cancer, wow, large, 11 cm. Thrombosis is safe to fly to your cancer zone. Yes, for renal cell cancer, renal cell is not sensitive to conventional radiation. However, renal cell is sensitive to Cyberknife, high dose radiation. When this is a big renal cell cancer, we have a special strategy using Cyberknife. We will treat the center part of the renal cell called SCOT technology. That's invented by me, and we have a 95% chance to control this renal cell 11 cm cancer, 11 cm renal cell tumor. Yes, I don't know whether the patient is safe or not, because it depends on the patient status. If the patient walkie-talkie is healthy, yes, patient can fly to our center, get treated. And if patient is very, very, very sick, and then we will recommend patient to recover first, maybe to stop chemo first, and rest for 1 week or 2 until the local doctor evaluate the patient, feel the patient is safe enough to travel. Then it's a 4 hours flight from Malaysia to Guangzhou. So another question is, can I ask if patient no longer need, or if a patient no longer need chemotherapy or other treatment? And well, that depends. That depends is if a patient had early stage cancer, such as lung cancer, early stage lung cancer, if you use Cyberknife, then the patient no longer need chemo. However, if a patient had a later stage cancer, that means there's already the chance the cancer cell already goes to other places of the body. Then you need a tumor to treat you still need a Cyberknife to treat the tumor you can see on the CT, on the MRI, on the PET CTs, right? You need a Cyberknife to treat that. However, you still need a chemo or target therapy or immunotherapy to treat the cancer cell that you cannot see on the imaging. Oh, somebody is so nice. They said, "Oh, only we can best use the Cyberknife." We appreciate it. I really believe we are the top 3, maybe the top 1 Cyberknife team in the world using the machine. Is that important to prime patient to optimize the immune system and prime patient prior Cyberknife? That's a great question. So these days, number 1, we will recommend the patient you could have a NK cell therapy, or you can have a PD-1, PD-L1 immunotherapy. Then you have a Cyberknife, and you wait another 7 to 10 days, as Dr. Yang suggested before, and then you give another immunotherapy. So yes, so it's good idea to prepare the immunotherapy prior or after or both Cyberknife. If you have to choose one, you typically do Cyberknife first, then you give immunotherapy 7 to 10 days after. That's going to be best to maximize the immune response. How long the patient needed to follow up? Well, it depends. Some to see the tumor shrink, right? Tumor response completely. Some tumors shrink dramatically very fast. Within 1 week or two weeks, tumor disappeared. But some tumor it may be there for 3 months, but slowly shrink. Some benign disease like acoustic neuroma, pituitary tumor, it takes years to shrink. It takes years to shrink. Doctor, if you already SBRT the prostate cancer, however recurred, would you still do CyberKnife for the same lesion? Possibly. If this prostate cancer recurred after SBRT, and after 1 year or 2, we will do PSMA PET, which is a special PET CT. The special PET CT will tell us where is the recur, and we will use the CyberKnife to treat it. And this is possible. So can CyberKnife treat MT, inflammatory fibrostic tumor? It's again, this the tumor that is not sensitive to conventional radiation. However, it will be sensitive to CyberKnife. And its head and neck, yes, we could treat it. We could. This is a very challenging tumor. However, we just for you know, for early stage cancer, our goal is to cure this patient. However, if the patient is late stage cancer, our goal is to give a patient quality of life, at the same time to prolong the patient's life. You know, if the breast DCIS means very early stage cancer, can we treat a CyberKnife without operation? We can, but we do not recommend. Right now, it's too early to do that for very, very, very early breast cancer, because it's very easy to do surgery. It's very easy to do surgery. So just let the patient do surgery, and we give a CyberKnife after. Simple and easy. Only when there's a very, very old patient does not want surgery, yes, we will offer CyberKnife for breast DICS. So anyway, I think there's how effective is the CyberKnife for cervical cancer? How many sessions are you really need? That's interesting. That's a very interesting question. For cervical cancer, basically we treat a lot of cervical cancer with CyberKnife, and particularly for cervical cancer that recurred. Typically we give 5 treatments for cervical cancers, and actually my partner Dr. Lanciano in America, she published a lot in treating cervical cancers with the CyberKnife. So we actually have a lot of experiences of doing that. Let me show you something. Sorry. Hold on a second. This is
WellAgain, Total Healthcare Solutions.